Introduction to Heart Valves and Aging. Welcome to our in-depth exploration of how aging impacts your heart valves and the steps you can take to maintain heart health as you grow older. The human heart is an incredible organ, pumping blood throughout your body around 100,000 times a day, delivering oxygen and nutrients to every cell. At the center of this vital process are the heart valves, four essential structures that ensure blood flows in the right direction. These include the mitral valve, tricuspid valve, aortic valve, and pulmonary valve. Each valve opens and closes with every heartbeat, preventing backflow and maintaining efficient circulation. As we age, however, these valves undergo changes that can affect their function. Natural wear and tear, combined with factors like genetics, lifestyle, and environmental influences, can lead to conditions such as valve stiffening or leakage. Understanding these changes is crucial because heart valve issues are common in older adults, affecting millions worldwide. In fact, by age 65, about 2 to 3% of people experience significant valve problems, and this number rises sharply thereafter. Aging doesn't just mean chronological years. It's about how our bodies accumulate damage over time at a cellular level. For heart valves, this often involves the buildup of calcium deposits, fibrosis, or degeneration of the valve leaflets. These alterations can disrupt the heart's rhythm and efficiency, potentially leading to serious complications like heart failure if left unaddressed. But the good news is that knowledge empowers action. Throughout this video, we'll delve into the science behind these age-related changes, explore symptoms to watch for, discuss diagnostic methods, and most importantly, outline practical strategies to protect your heart valves. Whether you're in your 40s planning ahead or already noticing subtle signs in your later years, this information can make a real difference. We'll cover everything from dietary tips to medical interventions, drawing on insights from cardiology experts and recent studies. Remember, while aging is inevitable, many aspects of heart health are within your control. So let's start by breaking down the anatomy of heart valves in more detail. Imagine your heart as a four-chambered pump. The right atrium and ventricle handle deoxygenated blood to the lungs, while the left side pumps oxygenated blood to the body. The tricuspid valve sits between the right atrium and ventricle, the pulmonary valve between the right ventricle and pulmonary artery, the mitral valve between the left atrium and ventricle, and the aortic valve between the left ventricle and aorta. These valves are made of thin, flexible tissues called cusps or leaflets, supported by chordae tendineae and papillary muscles in the case of the atrioventricular valves. With each beat, they snap shut like doors, creating the familiar lub-dub sound. Over decades, repeated mechanical stress, billions of cycles, can cause microscopic tears and repairs that accumulate. Additionally, age-related inflammation and oxidative stress play roles, accelerating degradation. For instance, endothelial cells lining the valves may lose their protective function, allowing harmful substances to infiltrate. This sets the stage for common age-related valve diseases, which we'll explore next. By staying informed, you can partner with your healthcare provider to monitor and manage these changes effectively. Common age-related changes in heart valves. As we delve deeper, let's examine the specific ways aging affects heart valves. One of the most prevalent issues is aortic valve stenosis, where the aortic valve narrows due to calcification, a process where calcium builds up on the valve leaflets, making them rigid and less able to open fully. This forces the heart to work harder to pump blood, potentially leading to hypertrophy or thickening of the heart muscle. Studies show that aortic stenosis affects about 12% of people over 75, often progressing slowly without symptoms until advanced stages. Another common problem is mitral valve regurgitation, where the mitral valve doesn't close properly, allowing blood to leak backward into the left atrium. Aging can cause the valve's supporting structures to weaken or elongate, exacerbating this. Tricuspid regurgitation is similar, but on the right side, sometimes linked to pulmonary hypertension that develops with age. Pulmonary valve issues are rarer in adults, but can stem from congenital defects worsening over time. Beyond these, fibrotic changes occur as collagen fibers in the valves become denser and less elastic, reducing flexibility. This is akin to how skin loses elasticity with age, but in the heart, it impairs blood flow dynamics. Risk factors amplify these effects. High blood pressure, high cholesterol, smoking, diabetes, and obesity all contribute by promoting inflammation and plaque buildup buildup in arteries, which indirectly stresses valves. For example, atherosclerosis in the aorta can extend to the aortic valve. Genetics also play a role. Some people inherit bicuspid aortic valves, which have 2 leaflets instead of 3 and degenerate faster with age. Hormonal changes, like those in menopause, may influence valve health in women. Importantly, these changes don't happen overnight. They accumulate over years, often asymptomatically at first. Early detection is key, as untreated valve disease can lead to atrial fibrillation, stroke, or congestive heart failure. Recent research from the American Heart Association highlights that lifestyle interventions can slow progression. For instance, maintaining a healthy weight reduces strain on the heart. In the next sections, we'll discuss symptoms that signal potential problems and how to recognize them. Fatigue, shortness of breath during mild activity, chest pain, palpitations, or swelling in the legs could indicate valve dysfunction. Dizziness or fainting spells, especially with aortic stenosis, warrant immediate attention. Regular checkups become vital after age 50, including echocardiograms to visualize valve function. By understanding these mechanisms, you're better equipped to take proactive steps. Think of your heart valves as the guardians of your circulatory system. Nurturing them through informed choices can extend their lifespan and yours. Symptoms and risks of aging heart valves. Now that we've covered the structural changes, let's turn to the symptoms and risks associated with aging heart valves. Many people live with mild valve issues without realizing it, but as problems advance, telltale signs emerge. Shortness of breath, particularly when lying down or exerting yourself, is a classic symptom of mitral regurgitation or heart failure stemming from valve disease. You might notice it during everyday activities like climbing stairs or even walking short distances. Fatigue is another red flag. If you're feeling unusually tired despite adequate rest, it could be due to reduced cardiac output from stenotic valves. Chest discomfort, ranging from a dull ache to sharp pain, often worsens with activity and eases with rest, mimicking angina. Irregular heartbeats or palpitations can arise from atrial enlargement caused by leaky valves. Swelling in the ankles, feet, or abdomen, known as edema, occurs when the heart struggles to pump efficiently, leading to fluid buildup. In severe cases, lightheadedness, fainting, or even sudden cardiac events can happen, especially with aortic stenosis obstructing blood flow to the brain. Risks extend beyond symptoms. Untreated valve disease increases the likelihood of complications like endocarditis, an infection of the valve lining, which is more common in older adults with pre-existing damage. Stroke risk rises if blood clots form in enlarged atria and travel to the brain. Pulmonary edema, where fluid floods the lungs, can be life-threatening. Statistically, heart valve disease contributes to over 25,000 deaths annually in the U.S., with aging as a primary factor. Comorbidities compound these risks. For instance, if you have coronary artery disease, it can accelerate valve calcification. Diabetes impairs vascular health, while chronic kidney disease alters mineral balance, promoting calcium deposits. Smoking damages endothelial cells, hastening degeneration. Gender differences exist too. Women may experience more mitral valve prolapse, while men are prone to aortic issues. Age-specific risks peak after 70, but earlier onset can occur with rheumatic fever history or congenital anomalies. Awareness is your first line of defense. Monitoring blood pressure and cholesterol levels can flag early risks. Family history of valve problems should prompt earlier screening. Emotionally, dealing with these symptoms can be challenging, leading to anxiety or depression, so holistic care includes mental health support. Fortunately, modern medicine offers tools for early intervention, which we'll explore soon. By recognizing these signs promptly, you can seek evaluation and potentially avoid severe outcomes. Remember, symptoms often progress gradually, so don't dismiss subtle changes as just getting older. Consult a cardiologist if you experience any of these. Better safe than sorry. Diagnosis of heart valve issues. Diagnosing heart valve problems in the context of aging requires a combination of clinical evaluation and advanced imaging. It typically starts with a thorough medical history and physical exam. Your doctor will listen to your heart with a stethoscope for murmurs, abnormal sounds caused by turbulent blood flow through faulty valves. A whooshing or clicking noise might indicate regurgitation or stenosis. They'll also check for signs like irregular pulses or fluid retention. Blood tests follow to assess for infection, inflammation, or related conditions like anemia that could exacerbate symptoms. An electrocardiogram, ECG, records the heart's electrical activity, revealing arrhythmias or chamber enlargement linked to valve strain. Chest X-rays provide a broad view, showing heart size or lung congestion. But the gold standard for valve diagnosis is echocardiography, or echo, an ultrasound of the heart that visualizes valve structure and function in real time. Transthoracic echo is non-invasive, using a probe on the chest, while transesophageal echo inserts a probe down the throat for clearer images, especially useful for mitral valves. Doppler technology within echo measures blood flow speed and direction, quantifying stenosis severity or regurgitation volume. For more detail, cardiac MRI or CT scans offer 3D views, assessing calcification or associated artery issues. Stress tests, like treadmill walking while monitored, evaluate how valves perform under exertion. In some cases, cardiac catheterization involves threading a tube to the heart to measure pressures directly, confirming diagnoses before surgery. Aging considerations include gentler approaches for frail patients, like avoiding invasive tests if possible. Early diagnosis is transformative. Mild issues might only need monitoring, while moderate ones could benefit from timely intervention. Guidelines from the European Society of Cardiology recommend routine echoes for those over 65 with risk factors. Telemedicine has expanded access, allowing remote symptom reviews. Interpreting results involves grading valve disease, mild, moderate, or severe, based on metrics like valve area or regurgitant fraction. For example, aortic stenosis is severe if the valve opening is less than 1 square centimeter. Multidisciplinary teams, including cardiologists and surgeons, review findings to tailor plans. Patient education during diagnosis empowers you to understand terms like ejection fraction, which measures pumping efficiency. If diagnosed, don't panic. Many live well with managed valve disease. Tracking progression through follow-up tests is standard, often annually for mild cases. Innovations like 4D echo enhance accuracy, capturing dynamic valve motion. By staying vigilant with checkups, you catch issues early, optimizing outcomes. Prevention strategies for healthy heart valves. Prevention is paramount when it comes to safeguarding your heart valves against the effects of aging. While you can't stop time, lifestyle choices significantly influence valve health. Start with a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those from avocados and nuts. The Mediterranean diet, emphasizing olive oil, fish, and antioxidants, has been shown to reduce inflammation and calcification risks, limit saturated fats, trans fats, and sodium to control blood pressure and cholesterol, key culprits in valve stress. Aim for less than 2,300 milligrams of sodium daily, ideally 1,500 milligrams if you have hypertension. Regular physical activity is equally crucial. Engage in at least 150 minutes of moderate aerobic exercise weekly, such as brisk walking, swimming, or cycling. This strengthens the heart muscle without overstraining valves. Strength training twice a week builds overall resilience. Quit smoking immediately, as it accelerates vascular damage and oxidative stress on valves. Manage weight to avoid obesity-related strain. Even a 5 to 10% loss can improve cardiac function. Control chronic conditions. Keep diabetes in check with balanced blood sugar, and treat high blood pressure with medications if needed. Statins for high cholesterol not only protect arteries, but may slow valve calcification. Stay hydrated and limit alcohol to moderate levels. 1 drink daily for women, 2 for men. Stress management through mindfulness, yoga, or hobbies reduces cortisol, which can inflame tissues. Vaccinations against flu and pneumonia prevent infections that could lead to endocarditis in vulnerable valves. Dental hygiene is vital. Poor oral health allows bacteria to enter the bloodstream and infect valves. Brush, floss, and get regular checkups. For those with known risks, like bicuspid valves, prophylactic antibiotics before certain procedures might be recommended. Supplements like omega-3s show promise in reducing inflammation, but consult your doctor first. Sleep 7 to 9 hours nightly for cellular repair. Community involvement or support groups foster adherence to these habits. Research from the Framingham Heart Study underscores that lifelong healthy behaviors correlate with fewer valve issues in old age. Track your progress with apps or journals. Prevention isn't one size fits all. Personalize based on your health profile. By adopting these strategies early, you mitigate aging's toll, potentially delaying or avoiding valve disease altogether. Empower yourself. Small daily changes yield big long-term benefits for your heart. Lifestyle changes to support heart valve health. Building on prevention, let's explore specific lifestyle changes that can directly support heart valve health as you age. Exercise tailored to your fitness level is key. Low-impact activities like Tai Chi or water aerobics improve circulation without joint stress, enhancing valve efficiency. Incorporate flexibility exercises to maintain overall mobility, indirectly benefiting heart function. Dietary tweaks include boosting potassium-rich foods like bananas and spinach to balance electrolytes and support heart rhythm. Antioxidants from berries, dark chocolate, and green tea combat oxidative damage to valve tissues. Reduce processed sugars to prevent insulin resistance, which ties to metabolic syndrome and valve strain. Hydration aids in maintaining blood volume, easing the heart's workload. Sleep hygiene, consistent schedules, dark rooms, and avoiding screens allows the body to repair valvular micro damage overnight. Mental health practices such as meditation or therapy lower chronic stress that exacerbates hypertension. Social connections provide emotional buffers, encouraging healthy habits. For smokers, cessation programs with patches or counseling double success rates. Alcohol moderation prevents atrial fibrillation, a common valve-related complication. Weight management through portion control and mindful eating avoids excess cardiac load. Ergonomic adjustments like proper posture reduce unnecessary strain during daily activities. Environmental factors matter. Minimize exposure to pollutants by using air purifiers as they can inflame cardiovascular tissues. Hobby integration, like gardening for light exercise, makes changes sustainable. Track metrics with wearables monitoring heart rate variability, alerting to irregularities. Partner with healthcare providers for personalized plans, perhaps including cardiac rehab programs post-diagnosis. Evidence from longitudinal studies shows that sustained lifestyle shifts can regress mild valve thickening. Community resources like senior fitness classes make implementation easier. Address barriers. If mobility is limited, chair-based exercises work wonders. Nutritional counseling ensures balanced intake without deficiencies, like vitamin D for bone and valve health. Hydrate with herbal teas for added anti-inflammatory benefits. Ultimately, these changes foster resilience, turning aging into an opportunity for vitality. Celebrate progress. Every step counts toward healthier valves. Treatment options for age-related valve problems. When prevention isn't enough and valve issues arise, a range of treatments can restore function and quality of life. For mild cases, watchful waiting with regular monitoring suffices, combined with medications to manage symptoms. Beta blockers or calcium channel blockers control heart rate and blood pressure, reducing strain on valves. Diuretics alleviate fluid buildup in regurgitation cases. Anticoagulants like warfarin prevent clots and atrial fibrillation linked to valve disease. For infections like endocarditis, antibiotics are frontline. As conditions progress, minimally invasive procedures offer alternatives to open surgery. Transcatheter aortic valve replacement, TAVR, is revolutionary for aortic stenosis. A new valve is inserted via catheter through the groin, expanding inside the old one. Suitable for high-risk older patients, it boasts shorter recovery, days versus weeks. Balloon valvuloplasty inflates a balloon to widen stenotic valves, often for mitral or pulmonary issues. For regurgitation, MitraClip devices clip leaky mitral leaflets together percutaneously. Surgical options include valve repair, preferred over replacement for preserving natural tissue, or mechanical biological valve implantation. Mechanical valves last longer, but require lifelong blood thinners. Biological ones, from animal tissue, don't but may need re-replacement after 10 to 15 years. Open heart surgery, though invasive, has high success rates in experienced centers. Hybrid approaches combine surgery with catheters for complex cases. Emerging therapies like tissue-engineered valves promise personalized solutions. post-treatment cardiac rehabilitation, supervised exercise, education, and counseling optimizes recovery. Lifestyle integration remains crucial. Medications alone aren't enough. Research from the partner trials validates TAVR's efficacy, equaling surgery outcomes with less risk for elderly. Cost and access vary, but insurance often covers proven interventions. Patient selection is key. Echocardiograms guide decisions. Complications, though rare, include bleeding or infection, mitigated by skilled teams. Follow-up care involves echoes to monitor new valves. Emotional support through groups helps cope with procedures. Innovations like 3D printed valves tailor fits. By understanding options, you advocate for yourself. Treatments evolve rapidly, offering hope even in advanced age. Conclusion and final advice. As we wrap up this comprehensive look at how aging affects heart valves and actionable steps to address it, remember that knowledge is your greatest ally. We've covered the anatomy, age-related changes like stenosis and regurgitation, symptoms to heed, diagnostic tools, preventive lifestyles, supportive changes, and treatment advancements. Aging may challenge your heart valves, but proactive measures can preserve their function well into later years. Prioritize regular checkups, especially after 50, to catch issues early. Embrace a balanced diet, consistent exercise, stress reduction, and avoidance of harmful habits like smoking. If diagnosed, collaborate with specialists for tailored treatments, from medications to cutting-edge procedures like TAVR. Stay informed through reputable sources like the American Heart Association. Support networks, whether family or online communities, provide encouragement. Ultimately, heart health reflects overall well-being. Nurture it holistically. Thank you for joining us. Take these insights and apply them for a healthier tomorrow. Consult professionals for personalized advice. This is educational, not medical counsel. Here's to strong hearts at any age.